Hello, it's Dr. Rhonda Johnson, and today is Saturday, October 15th, 2022. And today, folks, I'm talking about the Public Health Emergency Declaration. Well, if you haven't heard, the COVID-19 Public Health Emergency Declaration was extended for 90 days. It was first launched in 2020 and renewed ever since in 90-day increments. And this current extension will go through January 11th, 2023. Now, what is the public health emergency? What does it do? It makes it possible for the Biden administration to help the 17 million Americans who had expanded Medicaid and CHIP health insurance keep their insurance. It also supports the rapid development of drugs and therapeutics. Now, people ask, is this the same as the emergency use authorization process by the FDA, the Federal Food and Drug Administration? Well, the answer is no. They are separate processes governed by different acts. The public health emergency is under the jurisdiction of the Public Health Service Act under the Federal Office of Health and Human Services. Now, the emergency use authorization comes under the Federal Food, Drug, and Cosmetic Act, but it has to be justified by a public health emergency. Now, that seems complicated, but just know that they're slightly different, but kind of codependents. Now, the public health emergency also extends a lot of different provisions, and one of the most important provisions is around telehealth. It makes it possible to continue to offer a broader access to telehealth services, which were greatly expanded during the pandemic. So that's a quick update. I personally think extending the public health emergency declaration is a good thing because we are still in a public health emergency. Folks, this COVID pandemic is not over yet. And we have to make sure that Americans continue to have access to services and health care needed to combat this pandemic. That's my message. That's my opinion, of course. So have a good day and be well.